You know, when man fails to do what he was created to do, nature will step in and do the job. Greetings, everyone. DFG here, getting in flight. Hey, guys, I just read a recent article. Matter of fact, it was published on the 22nd of November, so about a week and a half ago. And I want to talk to you about this subject because this ties into what's going on now with, the emasculation of men and the promotion of homosexuality. And I know that again, with many people out there, this is a sore subject. But I bring this subject forward for educational purposes, so that you can be informed on whatever life choices that you're making. Okay, and if social media wasn't doing such an effective job, pushing, this particular agenda I'm talking about, the gay, homosexual, lesbian, queer, transgender. Um, I'm sure I missed one, but the whole homosexual agenda, then I wouldn't feel compelled, maybe, maybe not. But I'm just going to say I wouldn't feel compelled to bring this knowledge forward because this is important. And you need to know this, especially, the parents of small children who are under the, or still in that influential stage of growth. And you guys have heard me talk about in Chicago how they're pushing the agenda next year around, these homosexual or gay heroes. We also know about, I did the Coca Melon thing where they were showing the gay, the gay couples with, adopting children. And I can go on and on and on. And if you've been following me for a minute, then you know what I'm talking about. But just to get down into the meat and potatoes of, this whole thing around, not necessarily just about homosexuality, but I just want, again, to forewarn you. So, because a lot of us, because we are being intentionally, in my opinion, not told the consequences of the life choices around homosexuality. I think that there's an agenda that intentionally promotes the lifestyle, but it also intentionally neglect to tell you about the dangers of that lifestyle. So my intention is to do just that. I'm going to start, first of all, I'm going to read this article to you that I mentioned a moment ago. And it's from the New York Times, so just so you know, if you can see that, okay? And as you can see the title, HIV is coming to rural America, and rural America is not ready. And you can see that it was written by this guy, Stephen Thrasher. But let me get into the article. It says, stay with me, and I'm going to back this up. You know with the book. You know that's coming. Okay. While there are still about 1 million people living with HIV in the United States, and you wouldn't know that because they don't talk about it anymore on mainstream media. Living with HIV in the United States and some of America's largest cities, the news about HIV and AIDS is surprisingly positive. The new HIV diagnosis fall to historic lows, New York City Department of Health announced on November 22nd, reporting that the largest city in the United States had fewer new diagnoses of HIV in 2018 than during any year since statistics were first kept in 2001. This was just a few weeks after Philadelphia's Department of Public Health reported a 14% drop in the number of newly diagnosed HIV infections overall, a drop of more than 1/3 among black men who had sex with men, especially vulnerable population. Now they're saying that black people are especially vulnerable to HIV. And isn't it interesting that the men that we see in these dresses, supposedly heterosexual men, Perel, LeBron James, Dwayne Wade, many others, Jamie Foxx, I can go on and on and on, that these supposed to be heterosexual men, infeminizing themselves to push, this transgender, agenda. Okay, but let me continue on. But that we're a vulnerable population, we should be the last group, so-called blacks, pushing that, knowing that we're more susceptible to HIV. Now that's another story in of itself, and I'll talk about that at another time, because as many of you probably already know, there are a lot of people saying that HIV was a design drug that was intentionally put, into, the black community, whether it was Africa or here in the United States. Okay, but I digress. Let me continue on. San Francisco and Chicago have also seen the rates of new HIV infection falling. But while the robust municipal health campaigns are creating downward HIV trends in some of America's largest cities, in much of rural America, the opposite trend is emerging. There have, of course, always been cases of HIV in sparsely populated parts of the country. But in these places, far from cities, the conditions that led to HIV transmission are now intensifying. And rural America is not ready for the coming crisis. And they're calling it a crisis. Indeed, in Appalachian, West Virginia, the crisis has already arrived. A cluster of 80 new HIV infections has been diagnosed since early last year in Cabell County. As Tony Young, an AIDS activist, puts it, the epidemic of opioid addiction, fueled by drug companies' promotion of pain medication beginning in the 1990s, is a crisis for rural regions, in part because these regions are completely unprepared to deal with the magnitude of the problem. Ms. Young founded what is now called the Community Education Group in Washington, D.C. in 1993, originally to address HIV and AIDS in women. An African-American lesbian, she has spent most of the past 30 years working to help members of the Black, gay, and urban communities it affects. But since her recent move to West Virginia near the Appalachian coal fields, she's seen the crisis take a different shape. Unlike the large urban areas that have dealt with similar health and substance crises in the past and have networks of services providers and consumers in place, small rural health jurisdictions often lack the infrastructure to confront the crisis and have a little history of dealing with comparable health issues, she explained. And it's quite a crisis. Between 2006 and 2016, the Charleston Gazette-Mail reported nearly 21 million opioid pills. Okay, We don't want to. We're not concerned ourselves with opioid pills. You follow me? See, that's a distraction. That's to get you off. The title is HIV, and somehow or another it's migrated to opioids because it doesn't want you to see what's really going on. In my opinion, they're deflecting. Okay, but we're going to move on past that. Does opioid use have some effect? Probably, but that's not the main reason, okay? And it says in 2017 in Jefferson County, 1 in 4 people had a controlled substance abuse, okay? It says, okay, and then it goes on to say that, all right, let me move on. At the same time, the health care is relatedly inaccessible. It's not so easy to get to the nearest town to see a doctor, all right? Virginia University explained, pointing to a lack of transportation and stigma, the biggest barriers to testing and care. People living with HIV are stigmatized everywhere, but those who live in large cities can get tested while feeling relatively anonymous in the clinics in ways rural areas dwellers cannot. What's happening in West Virginia shouldn't be a surprise. After hepatitis C and HIV outbreaks in Indiana in 2014 and 2015, that was fueled by the deindustrialization, again in opioids. The Center for Disease Control listed a list of 222 counties similarly vulnerable to such outbreaks among people who use intravenous drugs. Okay. There is no way that doesn't wind up as an HIV outbreak in the state, Ms. Young says. Yet, unlike the places in New York, its comprehensive sex education, again, see, we're back at sex education. Okay, so they're telling us it's opioids, in one breath, but then right under there, covering it, is telling you it's about sex. Okay, its comprehensive sex education efforts, queer and trans-specific public health embrace of the public-centered exchanges, and what its health commissioner describes as sex-positive approach. When it comes to confronting HIV epidemic, rural America is ill-prepared at best and antagonistic at worst. For instance, despite research showing that syringe programs are effective in limiting transmission of HIV and encouraging people to enter drug treatment, 2 cities in West Virginia, Clarksville. Okay, again, it still wants to go there. I have seen such a tragic avoidable public health policies unfold in suburban settings in my own research. All right, let's go further. All right, criminalizing HIV is not effective in decreasing HIV rates. Of course it wouldn't be. One of the reasons the county wanted to prosecute and imprison was likely to prevent people from transmitting the virus to others to protect the public health. Okay? But Charles County closed its only clinic to sexually transmitted infections, which provided nearly 1,000 exams a year. With fewer people getting tested, with fewer people living with the virus, taking medication that could prevent the transmission to others, more people in the area could become HIV positive. While it's true that people who are black, queer, transgender, homeless, incarcerated, or poor, or who use injection drugs are disproportionately affected by HIV and AIDS. Now, isn't that interesting? We are the only ethnic group that they tied in with queer, transgender, homelessness, those incarcerated, poor, or drug users. Who uses needles to inject drugs in their bodies. They intentionally injected black. They didn't say Hispanic. They did not say white, Asian, or anyone else. They specifically called us out. Yet we're the face of the new homosexual movement. If you think about it, the black face, male and female, is the new face. Even the person who's discussing this, admittedly, she's a lesbian. Lesbian. Meanwhile, the rural heterosexual white Americans who have been subject to countless national profiles because they're imagined to represent all of President Trump supporters are more risk at all the time. But while we're bombarded by an analysis of many aspects of their plight, we don't hear about the crisis facing them. It's time for a change and for policymakers to root conditions that allow HIV and AIDS to flourish in rural communities. These campaigns will change, of course, providing much needed help for people of urban cities where HIV rates are also dropping. But the new major terrain of the crisis right now is rural America, and it can't be ignored any longer. Now, I shared that article with you again because why aren't we hearing about that? When they're promoting and they're pushing these entertainers in our faces, they're pushing these educators to educate our kids to embrace this lifestyle. Why aren't they telling us that HIV and AIDS is still on the rampage? And not only that, but in rural areas, it is out of control. And what is a rural area? Anywhere outside of major cities. And you have more rural areas in America than major cities in America by far. It's not even a comparable comparison. But yet, we're not hearing anything about that. Now, let me give you one more stat about that lifestyle. And this is a book, but this is a book by a guy by the name of Robert Jeffries, here or there. But he did some analysis from this group, and the group is who is the group that? The Medical Institute for Sexual Health, and this Dr. John McEnhaney. Check out some of these stats. All right? He says, AIDS is the primary homosexual disease that results from homosexual behavior. In 1998 alone, 16,642 AIDS cases were reported among homosexual men, whereas only 6,700 cases of AIDS were reported among heterosexual men and women combined. Okay? And then he goes on to say quite possible a number of them were actually bisexual. I'm talking about the women and men, the 6,000 versus the 16,000. Homosexual men are 8 times more likely to contract hepatitis, 14 times more likely to contract syphilis. Homosexuals account for 80% of all sexually transmitted diseases in the United States. And then it goes on, homosexuals are 18 times more likely to be involved in fatal traffics, 116 times more likely to be murdered, death from suicide, and then some more stats. Now, I say that, and I got to wrap this video up. But parents, I want you to listen carefully. I want you to share this video with friends and family. All those people who tell you that homosexual, gay is all about love, and it doesn't represent danger. It does.